Hi friends, welcome to our YouTube channel Odontology, the study of teeth. Today we are going to see about routes of drug administration in detail. To know about the routes of drug administration, first of all you should know the factors that influence the route of drug administration. It completely depends upon drug and patient related factors. Okay, this is one of your important 5-mark question in your second year pharmacology subject. So please listen. So let us discuss in detail. First, you should know the factors that influence the route of drug administration. Okay, factors. It completely depends upon two things, that is your drug and patient related factors. To know this, or you to keep remember this, you need to know one mnemonic, that is gap sec. Okay, or second gap or anything. Okay, or gap second, remember like that. Okay, so I am gonna write from the last letter, or you can write it from the first letter too. First, C is your characteristic of the drug. Characteristics of the drug, whether the patient is observed, whether the drug is observed by your GIT, or it should needed to be give through injection or inhalation. What is the characters of the drug, whether it can be observed or not, it is unobservable or anything. Okay, so you should know the characteristic of the drug, whether you can give it orally or parenterally. Okay, you will learn each one in detail. The forms of drug, whether it is encapsulated, entry coated tablets. So different forms of tablets are available. So you will see the forms of medicines and drugs in upcoming classes. Okay, so first one is your characteristic of drug. That means whether the drug is able to we are able to digest it, or enters, how it reacts, what is the action of this, whether it is quick onset or delayed onset, everything is the characteristics of the drug. Okay, second one is your emergency, whether the patient is in emergency condition or they came for a routine thing. Okay, emergency condition is nothing but if the patient is having any emergency situations, or if the patient is kept on vomiting or having diarrhea, they will land up in complete dehydration, right? So in such cases and all, you will give tablets, mean it won't react because they will keep on vomiting, so the drug will also come out through vomiting. So in such cases you have to go for another route. If it is for routine use, if the patient is coming with to you with a fever and all, you will give paracetamol, right? So that can be taken through oral, because that is a systemic one. So you can give a routine normal drug. So in emergency condition you can't give the oral drug and wait, because the action is also very late and you will have a delayed action. And the third one is your site of action of drug. Site of action of drug, whether you need the drug to be effective in local area or systemic area. In fever, same thing, in fever and all, you will give tablet which acts systemically, right? In case of any rashes or any skin disease or any wounds, you will treat it locally, right, to that area, the area which is wounded, right? So that is whether it should be local or systemic, the drug should be used. Okay, so that is your third point, is site of action of drug. Okay, this is the third one is, first one is characteristic of drug, second one is emergency or routine use, third one is your site of drug of action, whether it is localized or you need it to be acted systemically. And let's see the fourth one. Fourth one is your P. See, so fourth one is your patient condition, whether the patient is unconscious or the patient is having vomiting or diarrhea. In vomiting or diarrhea cases and all, if you are giving tablet, it won't react to the body, right, because the patient will keep on vomiting, so the tablet which they are taking will not get digested, and it will comes out while they are vomiting, right? So in such cases you won't prefer oral thing. Still you settle the vomiting first. Okay, if the patient is unconscious, means you can't give oral tablets, right? He or she is already unconscious, how can you make them to have oral medication? So we'll obviously give parenteral route, right? So the next one is your age of the patient. patient. This age of the patient only we will decide the dosage of the drug depends upon the age of the patient, and which route do we have to prefer also, it will depends upon the age of the patient. In certain, till the child reach the certain age, you won't conduct any surgeries, right? So same way, the dosage and everything depends upon the age of the patient, and route also depends upon the age of the patient. And the last and final one is your, here I am writing, okay, gastric pH, whether the patient is having acidic pH, okay, whether or digestive enzyme can digest the objects, or fast pass metabolism. Okay. Above all the 6 factors, one more factor is there. Totally I have written 6 factors, right? Beyond the 6 factor, you have one more factor too. That is your patient or doctor preference or choice. Okay, whether sometimes the patient will give, for example, if the patient is diabetic, and you will give choice whether you need to in a moderate range. If the patient is having moderate level of glucose, means the doctor will give the option whether they need to take via tablet, they need to reduce the glucose via tablet or insulin, injection. Okay, the choice will be given to the patient whether what route they can take. That is depends upon patient and doctor choice. Okay. These are the factors which influence the route of drugs administration. Okay, so totally 6 factors reminded as GAP-SEC. Okay, above all 6 factors, you have one more factor, that is patient or doctor choice. Okay, next we will see the classification of route of drug administration. Okay, so let's see the classification of routes of drug administration. Basically, you have 2 types, that is your local and systemic. This local includes topical form. It will act on either skin or in mucous membrane. We will see it in detail in next classes. Today we are going to concentrate in enteral route of systemic. Okay, so in systemic you have 2 types, that is, one is your enteral route, okay, and another one is your parenteral route. Okay, another one is your parenteral route. In enteral route you have 3 things. First one is your oral, second one is your sublingual, third is your rectal route. Third one is your rectal route. In parenteral, you have so many routes. First one is your inhalation, second one is your injection, third one is your transdermal, etc. Okay, today we are going to concentrate in this enteral route. First of all, to know these types, these routes, you have to know what is meant by enteral and parenteral. Enteral is nothing but enter, that means directly entering, directly enter or enter directly, that is enteral. Okay, parenteral means, para means opposite, enteral means enter. Okay, so direct opposite to the direct entry, that is your parenteral. That means enteral means it's directly get absorbed by your stomach, that is the drugs which we are taking through your GIT will comes under enteral. Okay, other than GIT, other than your mouth, other than your oral, that is your parenteral. Okay, so these are the types. Today we are going to concentrate in enteral route in detail. First one is your oral route. As I said earlier, oral route is a common commonly acceptable route of drug administration. Okay, it is observed through your, or it is, I mean, it is taken as a tablet, capsule or syrup through your oral cavity. Okay, that is through your GI tract. Okay, it is commonly acceptable drug. Forms are you can take as a tablets or capsules. Sometimes you will also take syrup, right? So these are the drugs, these are the types of drugs, forms of drugs that can be taken orally. Okay, so what's the main advantage and disadvantage of this? We all know, right? For example, if the patient is having fever, what will they give? Para, right? You will take para as through mouth only, right? You will take through oral only, right? So if the patient is having ulcer, what will you give? Pan 40 or pantoprazole, same thing only. Okay, or omeprazole. Okay, these drugs are taken through your mouth only. What is the advantage of this? The patient, if you are prescribed a patient with paracetamol, means they will take by themselves, right? So that is self-administrable. Straighted. Okay, and if you take one tablet also, it is safe, right? Don't care. So that is second one is safer drug. And third one, the patient feel very convenient to take that. Okay, because they are taking through oral only, right? So it is very convenient and painless. If the patient is having injection or anything, it will cause pain. But if you are taking a tablet, means there won't be any pain, right? So it is painless. Okay, and one more thing, it is cheaper, because one tablet will cost around, simple tablets and all cost around 4 to 6 10 rupees only, right? So it is cheaper. Okay, and what will be the disadvantage of this? First thing is, it is not suitable in emergency condition, because if the patient is unconscious now, you can't give oral tablet till it gets digested and release its effects. The patient will remain unconscious only. So in emergency condition, you should not give oral, because the action is very low action. Okay, low action. Then what may be the other disadvantage? You can't give, as I said earlier, you can't give in unconscious patient, because the patient is not conscious, so you can't give the tablet. It may got stuck in your throat region, right? So next, in severe vomiting and diarrhea condition, because if you are giving oral tablets, means the patient will keep on vomiting and they'll spit out the tablet, or it will come out through vomiting itself. So it won't get the patient who is suffering from vomiting or diarrhea, they won't get that vomiting to be stopped, right? So in vomiting, severe vomiting and diarrhea condition, you can't give oral route till you reach still you stabilize the patient. Okay, then you can't give unabsorbable drugs. So insulin and all you will give through injection only, right? You can't give it as a tablet. So that is your oral route. Okay, next we will see what is sublingual route. Sublingual route means this is your tongue. Imagine this is your tongue. The tablet is kept under the tongue. Okay, kept under the tongue. It is observed to mucous membrane, or observed by mucous membrane below the tongue. Okay, so it reaches the systemic circulation and you will have a quick onset of effect. Okay, direct. Okay, so this is how your sublingual route is taken. Okay, so the example for sublingual route is in angina patients, anginal attack patient. You'll give what? Nitroglycerin, right? Nitroglycerin can be kept under your tongue. Okay, And let us see what is the advantage and disadvantage of this route. Advantage. See, as I said earlier, quick onset will be there, because once the why we are giving a sublingual route means it will be direct, it will reach the circulation directly, right? There won't be any first pass metabolism and all. It will bypass the first pass metabolism, so it will reach the systemic circulation directly and quickly. So to rescue the patient from the anginal attack, we are giving nitroglycerin sublingually. Okay, so quick onset, and it will bypass the first pass metabolism. And same thing, self-administrable only, because this is also in a tablet form, right? So it is self-administration possible. Okay. So other thing is, you can terminate or decrease the action by spitting out. Okay. Once you spit out the tablet, the action will get terminated. Okay. Then what will be the disadvantage? Disadvantage of this sublingual route. First one is very bad taste and smell. Very bad taste and smell. And it will cause irritation also to the mucous membrane below the tongue. Okay. This is your sublingual route. The tablet will be kept in the region below your tongue. Okay. Let's see what is the rectal route in detail. Okay. Rectal route is through your rectal or anal region. Okay. It has two forms, that is solid and liquid forms. This rectal region is having high blood supply. Okay, so the absorption will be very good. Okay, so the upper part of rectum will reach the portal system, portal circulation, and the lower part of rectum will reach the systemic circulation. So it has both the effects. Okay. For example, examples are enema can be given through a rectal, right? So diciform in status epilepticus patient, or it can be given to geriatric and children's also, neonates. Okay, who's uncooperative, you can't give through oral route and all, you can give through rectal route. Okay, what is the advantage? So here I am writing that. What is the advantage? What may be the advantage? First one is your, if you are taking through rectal route means the GI irritation will be reduced, right? Because you are not taking through GI, so it is reduced, or there won't be. Okay, so it can be taken in neonatal too. Okay, they can't swallow the tablets, right? So in neonates and all, they will give through rectal. Oh, what may be the disadvantage of this? The main disadvantage is irritation to the rectal region. Irritation. So these are the three routes of drug administration comes under the enteral route of drug administration. This is also one of the 5 mark in your second year pharmacology subject. So please learn this question. If you have any doubts, please comment in the comment box. Hope you like the video. Thanks for watching. Thank you.